my name is Connor Howes and today I'll be completing Practical Assessment 32, Assessing Pain in a Post-Operative Feline Patient. This is attempt 2 of this assessment where I'll be going over a few demonstration points that I missed in my previous assessment. So our clinic uses the CSU Acute Pain Scale chart for both canines and felines. It is used to assess pain levels based on the individual animal species that is in clinic. We base it on the physiological and behavioural parameters noted within the enclosure post-operatively after surgery, the response to palpation, and the body tension noted. It is charted from a scale from minimal to severe with specific indications used to assess each. So you first want to take note of the visual image on the side and basing it on what you are seeing the feline patient observing in the enclosure. So I can see that he is showing this kind of hunched lowered posture. He has his tail curled up around him and tucked under his legs. He is still showing relative comfort, but he is hiding away from response to stimuli, from touch, and avoidance from any human interaction as well after the dental extractions. He is showing decreased responsiveness by hiding away in the enclosure, and he is seeking his own solitude with his reluctance to touch. He is quite quiet, but he is still alert and responsive. He has lost a bit of brightness in the eyes, which I've noted from the change in facial expressions, being the orbital tightening with his pupils have narrowed. He has lowered ears, he has a furrowed brow, and his whiskers have quite retracted, so they're tightly being pulled against his face. So I would be noting all these and giving them a tick, as I have been noting them. So he is not responding aggressively, but he is quite timid, and he is I can hear some increased vocalizations through meowing and yowling as well. No hissing or growling at all. So then you want to go to the body tension as well, taking note of the tension that he's holding within his abdomen or thorax and around the mouth area as well. I can note that yes, he is holding a bit of mild to moderate body tension as well. Majority is being held within the muzzle. We then want to note that we will be reassessing the analgesic plan, and based on the CSU pain scale feline chart which I had completed for Garfield, I had given him a score of 2, which can be noted here. This will then get informed to the attending veterinarian on the case, who would then advise if more analgesics would be required for Garfield to handle his post-operative pain. You then want to be coming down to the bottom here, using the visual indicator based on what side the pain is being noted on. It is very important to distinguish the specific side in which the pain is being caused. So he has had some right mandibular extractions today, so I would be doing that here, that it was quite warm, and tense upon palpation and very tender upon touch. It is important to note when assessing pain in feline patients that they indicate pain in a very subtle manner. They are very stoic in nature and they won't necessarily show pain the same way as canines. But other than that, that is everything today. That is Practical Assessment 32, Assessing Pain in a Post-Operative Feline Patient, Attempt 2.